Welcome all. It is my great pleasure to welcome you to another round of debates on the European Health, or rather as part of the initiative of the European Health Union, talking about the future of health in Europe and the implications of a strengthening of the efforts of collaboration across borders as part of course, the learnings that we've had during the last 18 months or so. My name is Lars Münter, and I'm your friendly host for this third of our Nordic debates. We've already had a debate from a Danish perspective, from a Swedish perspective, and we move into Norway. As you all know, Norway is actually not part of the European Union, but in many ways, of course, one of the more dedicated European countries you will ever find. So it's with great pleasure that today with me, I have three great speakers, Dr. Ilona Kickbusch, Christopher Lay of the Norwegian Health Directorate, and Bogi Eliasen of the Copenhagen Institute for Future Studies. But without further ado, it's my pleasure to give the floor to certainly one of the more dedicated Europeans on the health agenda, or the health arena even, you might say, Dr. Ilona Kickbusch, and introducing us a little bit about, so why a supranational initiative? What sense does that make? Please enlighten us.
Well, thank you, Lars, and hello to everyone, and to the co-panelists and the others in this discussion. I mean, first of all, the whole idea of a European Health Union is not that new, except it wasn't called that. For many years, even decades, many people have felt the European Union should have more health competencies, particularly in the field of public health. But as you know, some core countries, last not least my own Germany, was very, very opposed to the Commission taking on more responsibility in this arena. So while this discussion of a European Health Union has gained more interest and is being framed much more clearly over the last year or two, it's actually something that's always been there. And actually, even Robert Schuman, when the process of creating what was to become the European Union was in process, indicated that health should be a major component of it, because it's a key element for the citizens of Europe. It is something they would expect, that they have access to good healthcare and to good health. Now, the second point is that, of course, during the pandemic, it became clear that Europe didn't function so well together in many different areas, that borders came up again, that responses were uncoordinated, that countries were actually competing to a certain extent. And that led the European Commission, and particularly Ursula von der Leyen, to speak about a European Health Union. Actually, also, and this has been interesting in the context of the pandemic, is that countries like Germany, for the first time, actually also said there should be more cooperation on health within the EU, and both the German Health Minister Spahn, but even Angela Merkel spoke about the need for a European Health Union. It was focused, though, in the discussion as, and I quote Ursula von der Leyen here, to better protect the health of our citizens, but very much focused on pandemic preparedness and response. And a very strong focus has been the strengthening of existing mechanisms, of existing agencies. How can we strengthen the ECDC, the European Centers for Disease Control? How can we strengthen the European Medicine Agency? And then finally, also, should we not create a new agency with more research focus and which will help us be better prepared, modeled on the American BARDA, which in Europe got another name of a goddess, meaning Hera. So that was very much the equipment of the EU and its member states to better prevent and address future pandemics. But also there was talk of how can one increase the resilience of European health systems. And two things were also mentioned regularly, because also on the one hand, experiences with the pandemic, and that is the whole aspect of a pharmaceutical strategy for Europe. Partly that's related with EMA, but the larger issues of supply chains and high standards for medical products globally that are related then to vaccines, the vaccine import-export experiences and all of that. There was less talk, and I'll come back to that in a minute, on global issues and global solidarity challenges in this context. But finally, what has also been added has been the link into existing or strengthened other initiatives, such as the European Cancer Plan, for example, that should also constitute this European Health Union. So existing programs should be strengthened as well. And of course, as you all remember, there was a big discussion about the budget. Also within the European Union, it was initially cut, even though significantly increased for the Health Directorate, and was then increased by the European Parliament. That also indicates there is not a total agreement as to what a European Health Union should look like from the side of the Commission, from the side of the Parliament, and the side of the Council members, the countries. My last point is that taking this up has been a group and an initiative that has put forward a manifesto for a European Health Union, which I belong to and which is managed by the European Health Forum. Gastein also includes the former commissioner, the former health commissioner, and we have put forward a manifesto which actually says we need to think further. First of all, that probably to have a really strong European Health Union, it would require treaty change, and that the competencies of the Commission should be put forward much more clearly than they have been so far. And provisions for such a European Health Union should appear in Article 2 and Article 3 of the Treaty of the European Union. And so Article 114, this is, for the specialists in this field, would need significant amendment. We talk a lot about the solidarity within and among member states, also in building health systems and ensuring universal health coverage, but also the strong link to two other parts of activities of the European Union, and that is on the one hand social Europe, because there are significant health inequalities, but also of course the Green Deal, which is very significant for any kind of health impacts that we also have in relation to environmental sustainability. There is a lot of need for greater security, but not just health security, but also social security within the European Union. And we also speak of a much larger voice for patients and citizens. And that also means for the European Parliament in the context of health priorities set by the Union. So in a way, it's also trying to rethink and reinvigorate issues around solidarity, dignity, human rights that are very much part of health and are part of a slightly broader, different notion of health in all policies, which has been adopted by the European Union and is part of the work of the Commission, but has never quite found a really, really strong a way of implementation and application, I should say. My last point is that if we take health really seriously, the health impact of the European Union should be measured, both within the European Union, but also abroad. That leads us, to what we call the Brussels effect, that if the European Union is active in certain areas, that impacts on other parts of the world. We know
I think we lost the connection a little bit to Ilona.
Exports that a European Union has to be a globally solidaric European Union, and that the first steps that the European Union has taken to be a more responsible global health actor need to be significantly strengthened and taken forward. And the European Union should, at this point in time, actually be a leader to ensure global health, vaccine equity, for example. But here too, there are many other elements which go far beyond development policy. For example, the pharmaceutical policy, think of the intellectual property negotiations at the World Trade Organization are one example about European positions that influence global health. So I'll stop there. A very big agenda, but an agenda that cannot just be about pandemic response, as important as it is. My very last point is a figure. The American president announced just a couple of days ago that there should be an investment of 65 billion US dollars in strengthening the United States public health and health system to be better prepared and to be able to respond to pandemics. So that sort of gives you a level of money one should be looking at if one looks at the whole of Europe. So we're saying this is not just a couple of millions here and there. This is really talking big in many policy areas. It's talking not just Europe, but global. And it needs to be based fully in global agreements like the Sustainable Development Goals. Thank you.
Thank you, Ilona. So essentially, of course, about leadership, about linkages, and certainly also about learnings from the situation we've been in. And we'll come back also to talk more about the many, as you say, issues, the interconnected issues that we've talked about so far, Ilona. But moving on to Christopher Leigh from Norway, about learnings. I mean, how has health policies, we've now actually dived into a lot of different policy areas, the social area. You didn't mention climate per se, I think, Ilona, but that could have been there too, I suppose.
The Green Deal is definitely about climate, is it not?
But how has health policies in Norway shifted during Corona or following Corona? I mean, we are sort of still here, I suppose, sadly. Christopher.
Yeah. Thank you very much, Lars, and thank you very much for the opportunity to being here and talking about such a very important topic. And my name is, as said, Christopher Leigh, and I'm currently the senior advisor at the Norwegian Directorate of Health, and I'm also doing my PhD on youth health literacy at the Inland Norway University of Applied Science. And thank you so much, Ilona, for your valuable words and advice. and I'm very pleased to be here and listening to you. And I'm also looking forward to listening to Bogi afterwards. So back to your question, Lars. Actually, to answer to your question, I think it is first and foremost important to remind ourselves of what health policy actually is, and to be able to look at what objectives we had before the pandemic, and how these objectives changed during the pandemic, and or how they were adapted to the pandemic situation. So I think WHO defines health policy to be the health goals at the international, national, and local level, and specifies the decisions, plans, and actions to be undertaken to achieve these goals. And we must admit that a strong healthcare system has been crucial in controlling this pandemic, and will absolutely be for the next as well. And that the pandemic has demonstrated the true value of a thorough prioritization process in the countries. And luckily, Norway has had one of the earliest and most systematic prioritization efforts in the world, in which justice and equality were some of the fundamental values. But the basic principle is that everybody shall receive health services based on their individual needs, regardless of their residence, age, gender, ethnicity, and socioeconomic status, and so on. And in Norway, there are the three main criteria: the severity, effectiveness, and the cost, assessed simultaneously, will form the basis for which health services to be provided. And this is one side of the health policy. Unfortunately, prioritizations occurred at different levels, and at the political level, the decisions is more about the allocation of resources in between the entire society, and at the administrative level, for instance, municipalities and hospitals, and at the clinical level. And the discussion is mostly about the use of time, waiting list, and refusal of patients' desired interventions. And the question is, regardless of levels, that who shall get and who shall not get help in terms of the best available treatments. And based on that, I would not say that our health policies have significantly shifted during Corona, but I think it rather emphasized the importance of a thorough and focused implementation. And Corona has put the health system under pressure. As said, a strong health system is crucial in controlling this pandemic. And I can mention the strategy of the Norwegian Directorate of Health, in which the user first is one of the four main pillars to achieve good health to all. And the user means patients, relatives, and the residents in Norway. And this strategy was developed in light of the government's policy at the Patient's Health Service and the National Health and Hospital Plan. So the user's needs are a driver for change, and users have new expectations of what the services and administration should be, and they have more knowledge about their own health, illness, and opportunities for coping. However, the users inevitably may face a very complex health system that requires a competence to deal with. And this is the reason why it is important that all service development includes systematic user involvement, equitable user participation, and to facilitate for user involvement in the health and care services by having in place the tools, methods, systematics, culture, and even the values. And already in 2016, the Norwegian Directorate of Health established the National Service User Council, which is a very important body where the health authority discusses the plans and strategic issues with the user representatives. And this makes sure that the service development always takes into account the user perspective. And during the pandemic, this policy and its goals has become even more relevant. And several committees were established with a focus on an involvement of different user groups, including the immigrant populations. So the COVID pandemic has influenced and accelerated the work to increase the population health literacy, as the user involvement and empowerment and so on. And experiences during the pandemic has provided valuable insight into the needs for health literacy interventions and identified health literacy as one of the key drivers to successfully reach out with vital information to the entire population. And from the first phase of emergency preparedness during the pandemic, it has been important to adapt the communication strategies to so that the entire population shall access and understand the health information related to risk of infection, health behavior, testing and treatment, regardless health literacy levels, language competence, and digital skills at all. So this is what is the status and the situation in Norway. Thank you.
Thank you, Christopher. And indeed, a health system that listens, a health system that co-creates as well, focusing on competent and empowered citizens. And I guess also a key learning from what you're saying here is that, well, you built the strategy without necessarily building it for the pandemic. And that's, of course, an essential part in planning for better health, that you're doing it for a long term and not for disasters per se. But of course, it has to have the resilience to actually cope with disasters too. So looking at across borders then, Bogi, if we move to your field or your hobby horse, if you will, Bogi, looking across borders and with the cases of Ilona and Christopher here, we have some very good cases of linkages and learnings and ambitions in strategies. So clearly we're on a right and good track, aren't we, Bogi?
Yes, we should just sit down and have coffee. So yeah, I think there are a couple of things, and thank you very much for this very good examples, Christopher and Ilona, and also overview on the things. I think the challenge is we have seen some good things in the pandemics, but we have also seen some huge challenges. There's clearly a difference. So, for instance, if we take Christopher's example from Norway on the readiness on the infrastructure, is also something that we partly have seen in Denmark. So the digital infrastructure was quite solid, but it still took at least half a year to activate and repurpose it to a pandemic, if not a year, in order to get things to work. So and Norway, of course, is probably the only country in Europe who could say that, oh, if we really want, we actually have some money to do things. That doesn't really exist in other places. I guess that's a luxury in order to work. But what I think is doing it hard to work cross country is that it comes more up as acute need. It doesn't come up in a deliberate direction, which the European Health Union is about, which is why I, like Ilona and also you, Lars, are active in this. So what is the direction we go for? How do we build this together? And I think there are several challenges, and I very much agree with Ilona that there are several policies being framed now in Europe. So one of is the pharmaceutical, which is both about how do you have a business and how do you have cheap medicine at the same time, and how do you achieve that equilibrium in between it. But it also comes very much into the prepared research. So the European Union has used the last, I think, 8 years, at least some focus on establishing strong research infrastructures across the boundaries. Nobody knows about them. We work a bit with them, but and Denmark is not, Norway is active in the biobanking, but I don't know if it's active in anything else. Denmark is, I don't think, active in anything of it. So there are some of these structures that we are not really using. And then the purpose, I think, is with the health system is also extremely important, because one of the benefits with, or one of the good things we have learned from the COVID is that people suddenly realized that public health is really important. And if we want to go towards personalized health, we can't do it without public health. It's not opposing, it's yin and yang in that part. And what we want to achieve is also quality of life and well-being during the lifespan, not necessarily more hospitals. I mean, more hospitals might be a way to work with a part of it, but the idea of a health system should not be to provide as many treatments as possible, but to keep people as healthy as possible. And I think that, and it can sound a little bit absurd, but if we think about the core dynamic, which is hard to move, health is still partly employment policy in regional politics. And that is a huge blocker. It's not just the national parts which have hard with it. And then nobody is really solving the issue with health as an investment. What is the business model? How do we show that it pays off to invest in health? How is that a sound long-term political advice? And I do think some of these things are necessary in order to get the stakeholders to risk, so to say, to go for the cross-country collaboration in it. And we already have, Ilona mentioned some of them, health and all policy, the SDG 3, leaving no one behind, the WHO also phrasing of access to health, not just access to healthcare in those parts. So how are we pushing this forward across boundaries? Politically, there's no benefit in working cross-country. If you fail, you get punished. If you succeed, nobody cares. So it's hard to get politicians to push it. But the real part here is that if we want to go towards a learning health systems with data, if we want to work with personalized health based on genomics, the European countries are too small. No European countries can lift that alone. If we want to go into precision medicine, it has to go with data and learnings across boundaries. And one of my, because I've spent some time in Eastern Europe, so one could say that once things become more digitized, Eastern Europe would catch up. I know it's an extreme case with COVID, but the difference in the polarization is becoming bigger. So how are we also becoming, where is the solidarity in the union? And that solidarity is in the end what can help us with building the European way, which is not the American way, it's not the Chinese way, but it's the European way, where Lars and me often have talked about the Nordic helping in defining in Europe, but it is a European moral codex or compass in it. And as you also said, Christopher, without health literacy, this is going to be almost impossible to work with. But health literacy is also the biggest asset for prevention. It's not just an understanding when you're ill. And I think the Green Deal, I agree. It's very important also to keep health, but I would say that outside of the richest areas, also in Europe, if health is not nurtured as the most important pillar in society, there is no energy to work with a Green Deal. There is no energy to work with the climate changes because the lack of life conditions and the uncertainty with possible health conditions takes your energy. So that's where I'm. If we go on the cross border, there are some aspects of good things, but there is a lot left to work with. And my fascination of the European Health Union is that finally we have actually quite a lot of people trying to figure out a direction that we can align on, work with, because without a direction we won't get there. We can't do it piece by piece. Thank you.
Thank you, Bogi. So a key point here is, of course, that this is not just a matter of finding more money or more resources. It's as well also a mindset thing where, for once, well, size does matter when you talk about personalized medicine. We actually need the numbers, to reach the individuals, or to help the individuals. But talking also, I guess, about carrots. Carrots for politicians. There are precious few of them, Bogi points out. Is this an area, Ilona, maybe where we can talk about carrots and sticks, maybe also in terms of decision makers? What are the important levers that we should consider in order to go forward, either with a stronger health strategy, as Christopher points out, it has to be in place even before the house is burning. But how can we move that to come closer to that strategy that, well, has had its ups and downs the last 18 months or so?
Well, of course, there are many different ways to approach that. And there is this relationship, and this is where the meetings of the European Council, of course, are so important, between what you want to gain at the national level through better cooperation. And so, of course, a system within the union of better information exchange, for example, greater levels of transparency, sharing of data, a new form of data solidarity between the countries, the sharing also of health systems in the sense of cross-border support if there are problems, but also in relation to rare diseases. This is an issue that our group has taken up in particular. There can definitely, and this is where Bogi's point comes in, with doing a good investment plan, is that yes, if certain investments take place at the level of the European Union as a whole, as we have seen now with agreements on other investment plans in terms of rebuilding Europe, that can be a tremendous support, particularly to the poorer countries in the European Union. Because obviously we know that there are countries that are still far removed from having good health services, from having universal access. And I think we must also always keep in mind that health is part of defining your quality of life. Bogi alluded to well-being and the well-being agenda. And people will not be committed to Europe, particularly in certain of the poorer countries who have also come out of authoritarian systems, if they feel that this union has no direct benefit for me at all, but is actually leading to higher inequalities, more corruption in my country, etc. So I think if the Commission and through the support of the European Parliament in particular, could help build a system of sustainable health systems throughout the Union, if actually there were an agreement on standards, on levels of quality. Some people are even suggesting a European type of health insurance, that covers all countries and goes beyond, these agreements of access to healthcare in another country if you are traveling. And that, of course, and Bogi alluded to that, is so important in terms of open borders and the right to work in other countries. And it is absolutely not acceptable, in my view, that the rich countries actually build some of the emergency support for their own health systems and also health care at home on the impoverishment of other parts of the European Union. If you have carers from Eastern Europe come across the border to work and live in the richer parts of Europe to be able to feed their families back home, or if rich health systems take the nurses from poorer parts of the European Union, then there is no chance that they will be able to build their health systems. And that also relates to research, that relates, to just running good health systems. If your medics are taken away because, they earn better money, and you can't blame anybody who will then use the freedom of movement to get a better life for his or her family. So that interface that Bogi spoke about of certain freedoms in the European Union that have not led to freedoms for and better life for many other parts of the Union, I think are critical. And we must always see health together with the promotion of democracy and equity in the European Union. And I feel we don't do that. We neglect it at our peril.
Important point about the key value of, health for democracy. And also in the same sentence, actually in several sentences here among you, the word solidarity. And yet also investment policies. It's there's a different worlds apart that are meeting in a perhaps a wonderful union at one point. Coming to that, Christopher, of course, Ilona here speaks about the solidarity across the union, to which one could not necessarily say that Norway should be as solidary as the rest of them. I mean, the union members should, of course, take care of their own members for sure. But international collaboration, though, what's the view when you think about international collaboration? I know that you've been active in the WHO Europe as well, but working at an international level for health, is this simply knowledge sharing, or is there something, as Bogi alludes to too, actually the need actually to interact, to be able to solve those problems? What do you feel?
Yeah, I can look at this from the pandemic point of view, and of course from health literacy. It's my topic within the health policies. So international collaboration has been central to controlling and managing the pandemic, and making good decisions and developing a basis for choosing an effective strategy. And I'm also I agree very much that no individual countries would be able to handle the crisis alone. So collaboration is crucial for every country during this pandemic. And Norway has been an active part, both in Euro, but also to the global WHO, the World Health Organization. And I can roughly mention some of the most important international networks and cooperation that have been utilized during the pandemic, just to demonstrate the value and the importance of partnership, and of course the solidarity and so on. And during the pandemic, actually, we arranged several seminars for the Norwegian health personnel, where the health personnel from the intensive care units in other countries shared their experiences of handling the COVID situation. And it was so important because on this background, we have learned a lot from countries that somehow have been ahead of us in terms of the escalation of the pandemic. And we have also participated in a number of arenas to gather information, for example, in the EU Health Security Committee, as well as in direct contact with other countries. So, but in on other arenas, we also took a more active role. For for example, taking part in several working groups. For instance, one of the working groups has looked at the measures for the vulnerable groups in other countries, as well as normative products from, among others, the World Health Organization, the EU, and the ECDC. And we have also collaborated on the Nordic Working Group on Mental Health, where we discussed the prevention of suicide and other challenges for mental health during the pandemic. So, and another example is that Norway also participates in the EU Commission's urgent call for the population health information research structure to facilitate and generate the best available evidence for research on health and well-being of populations as impacted by the COVID pandemic. And this structure will allow for better coordinated European efforts across national and European stakeholders to generate the best COVID-19 population health knowledge. And under this umbrella, an informal rapid response network has also established, which meets weekly to exchange information from more than 30 member countries. And this has been a success factor in being able to act quickly on change and development in Europe during the pandemic. But having mentioned that, and within the framework of the topic health literacy, we have also collaborated with the expert groups for NCD within a Northern Dimension partnership in public health and social well-being, and initiating a systematic review on organizational health literacy, and also we are a member of the WHO Action Network on measuring population and organizational health literacy, and we are planning further surveys to map, the health literacy in populations and in organizations. So the pandemic has also clearly shown that there is a need for strengthening the European Health and Emergency Preparedness Cooperation. And as said, the individual countries have not been able to deal with this crisis alone. So, to be solidarity, to have solidarity is also one of the focus for us. I'm not sure if you have mentioned the EU for Health program. This is also one of the the area that would strengthen our participation and how we contribute to the European health as well. I can talk a little bit about it if you want.
You're sort of taking the words right out of my mouth, Christopher. But if I may, I'll ask Bogi a question here, because as you point out, well, there's some really decent learnings about international collaboration, how that can help solve a task. One could actually get the idea that it actually would be a concept that you could use even when there wasn't a pandemic. That you could actually work. Focused to solve tasks cross borders. So is that then, that's the question for Bogi, I suppose. Clearly there's some huge benefits that Ilona points to, and Christopher says that it really, really helps. So clearly across, in capitals across Europe, you are witnessing, Bogi, a lot of people seeing the light and starting to collaborate without any challenges or borders, or is this paradise?
Well, I think if I can rephrase the question a little bit on it, or put a frame on it. So I think what challenges did arise with COVID that we were not aware of before? Of course, there was a pandemic to deal with, which wasn't there before. But the rest of the challenges in the system, which we say that COVID might have helped in order to have public health, in order to be more digital, in order to have testing more efficiency, these were challenges we knew of. So these were not new problems. So we started to work in Latin America just before the pandemic and decided to continue even remotely afterwards, because we had pointed out that a slightest shock to the system would make them all break down, which happened. So that is one side of it. And okay, Lars and me have of course been active in the Nordic health movement for the last 2 years, which was not dependent on a pandemic. So I think again, and this is where I also am with Ilona in the Skiana network, which is very much about leadership on the health leaders. So again, I think that collaboration without a common direction, which looks a bit forward, is extremely hard, because then it's going to be piecemeal by piecemeal. And that won't give us what, for instance, the idea with the manifesto of the European Health Union is. It's more, what does this look like if we build health as a core component of it? And I think it's also Vitanis who has said, maybe I'm quoting him wrong, that the challenges and the core elements in the treaty today are based on things which are not so important for the European Union anymore. While health is where we have the level we are on is very important to push health forward. So Lars, concretely to your question, no, I'm seeing a lot of sunshine in how do you say that in English? Skåltaler, you might have a word. So at the gala dinner at conferences, there might be a lot of sunshine, but the day is already dark there. So just saying that there is a lot from understanding and wishing, and this is where the investment coming back in. So when I refer to investment, it's both the long-term investment that we would get in the European Union as a political compromise. It's also in the countries. It's also the frames for business investment, but it's the most important thing is to collect the knowledge and evidence and build the business case why this is good, why this is the most important pillar for progress in society, how it pays off, how it's a winner for each individual to have better health, but the society also progresses more by doing this. So that business case, we haven't really done our homework in getting that forward. I think that is really needed from the public, from the political side, from the administration, but also from the businesses and the civil society. And I think this is what we need collectively to align on and use for the direction. I mean, this is why we say it's an investment and not a cost, but we still need to prove that case.
Indeed. Well, without necessarily thinking, of course, I know that that's not your point of health as being a commercial enterprise. There's still, yes, of course, the key about a business case. So if both sort of as a question for both you, Ilona, and you, Christopher, what's the, I mean, we have EU for Health on the line here. I mean, it's ready to go. It's here already. The European Health Union initiative, and I can be conscious of the fact that since you're not a member of the European Union, Christopher, you will tread lightly, but still, Ilona, what's the sort of the business model for an individual country? I mean, why go the extra step to the European Health Union? I mean, treaty change, that's hard. It's I mean, we have the train ready to go with the EU for Health. Isn't that enough?
Well, in our group, we don't think so, because first of all, the pandemic has shown us very clearly what it costs if we are not prepared, if our systems are not prepared. And if we only look at this country by country by country, because, you know, if you have more than 20 member states and you have a major division between them, and you even exploit the resources of one part of your union in order to ensure a good quality of life in another part of the union, that just doesn't carry you forward. So the issue is, you know, we have seen what it costs if we don't invest, and to some extent, while I agree with Bogi, calculations can always get better, but at the same time, we do have, a number of calculations, what inequality costs in health terms, what smoking costs in health terms, what obesity costs our societies. So we do have all that money, and sometimes I'm actually not that happy about with this discussion of the economic calculations, because we have had these calculations for 20, 30 years, and they have not driven policy. And therefore, the question then, of course, becomes what drives policy. And it's not really always the best economic argument that leads to political decisions. I think then our economies would sometimes be working better. But I would like to add one thing that at least in our group, we think that is essential. You mentioned at one stage, Lars, also the values. We have reached a geopolitical phase where we're starting to have a systems competition again. And we've had the discussion following the Trump years, following Afghanistan, etc., to say, what does Europe stand for? Where is Europe as a model, as a geopolitical actor? And I do think, there are geopolitical costs we might pay if we do not invest in health and well-being. And that there are issues here, both in how seriously the health and well-being of the citizens of the European Union are taken, but also to what extent the European Union is willing to invest and support health and well-being in other parts of the world. And if you just take the last year, Europe was seen very positively at the beginning of the pandemic, when it took action, also financial and political action, to support the WHO, to support COVAX, to help in a whole number of ways to put global health solidarity high on the agenda. And then came the point when the European Union said, we will not support a TRIPS waiver. We will not support the sharing of vaccines. And we do not have enough money for development aid. And we also see that movement in some of the Nordic countries, that development aid is being reduced, for example. So in terms of promoting our system of democracy, both within the Union, and some countries there are not as democratic as maybe the Constitution of the European Union would want them to be. And on the other hand, being a strong partner with strong values internationally is something you can't just calculate with dollars and cents and euros. It's something with enormous consequences, and one needs to think about it very seriously, which is one reason the European Union has suggested a pandemic treaty, for example, that binds all countries globally. So I think there is something else around investment that we need to think of. And of course, it's a protection of our way of life. It's a protection into our security, and it's a protection of our democracy.
Simply health as a strategic resource globally as well. There's a comment from Bogi, and I think we have to ask Christopher a little bit for a comment also. Bogi?
Yeah, no, I'm in agreement with Ilona on that it's value. I mean, it has to be value driven. It's a European way in this, and I also agree very much on that. We have had a lot of calculation, but nevertheless, I think so it's not just the foreign ministry and the health ministry that needs to be convinced here, and who is sitting really with the hard burden economically now are to more and more going to be municipalities, for instance, because these are going to be elderly people with chronic disease, people that need more and more people needing more and more care for a longer time, which is not necessarily in the core of the health service providing health system. And this is, so when I'm I should also refine, because I think I've been little bit brutal on how I mentioned the business cases. It's more about showing and how can I say, also getting other non-traditional partners to lift the burden, both in the public system and outside of the public system. So convincing the health ministry might not be so hard, but the finance ministry might be very hard. Convincing the industry ministry on not just thinking about exporting more the next year, but actually working with life science in a way that helps the country as well. So I mean, one thing is can be a bit entertaining to listen to, that everybody wants to be the world champion in exporting health solutions and do health tourism. I mean, where do we find the patients? It's actually about not having more patients, right? So I'm in on that, and as Lars and me also in this Nordic process spent a whole lot of energy on refining 5 Nordic values to work together around as the main driving force, because technology changes so fast, so we can't use it. And it is more value than the business cases support than the other way around, just to be clear on that. But I do find that in the several pockets in countries, it's not clear to people what the business case is. And Ilona, to your point, we have the numbers, yes, but the payers are in siloed. So that's where the challenge is. So that's what I mean. How do we get that clear so we can get beyond that?
Thank you, Bogi. And then actually, though, a question for Christopher. I mean, as Bogi also alluded to, and I think most of our participants will probably know, normally access to resources is not necessarily what we think that Norway has a challenge with, but clearly. Would you say that that Norway would definitely also benefit if the European Union got its Health Act together?
I'm not sure that I can speak on behalf of the Norwegian
but you're smiling still, I can see. Yes.
Yeah. but if we take a example of the recently proposed EU for Health program, so and based on the democracy in Norway, and that you have to get your participation approved by the parliament to get the finance, the financing is not one ministry who decided whether Norway will participate in a program in the EU or not. It's about the improvement by the parliament as well, and I agree very much to Bogi as well, that we have to build a business case and what is the investment about, and what kind of values to be added to the national context, to the national health context, and the benefits from the investment as well. Even though we know that collaboration is a strength, and what we have seen from the pandemic as well. So I will say that if we find the benefit, the values of being a part of a European Common Act on Health, then I think it would not be a problem for us to support that. Because the situation by now is that our parliament already have approved the participation in the EU for Health, and we we have already discussed what kind of objectives of our participation, and it was about, you know, improving the emergency preparedness through the program, and it's about strengthening the community and the public health by collaboration with the other countries and the Europe as well, and how to be digitally integrated in the EU health system. So this is that is one of the objectives. So my opinion personally will be that I don't think it would be a problem.
That's great. And what a geopolitical win, I suppose, also. If we had the European Health Union, Ilona, that's what I heard him say, Norway would become a member of the union, right? No, sorry, Christopher, I'm only teasing. But indeed, it would be a wonderful addition, I suppose, if you're a passionate European, to have Norway at the table. It's been a wonderful pleasure to have all three speakers at the table today. I look forward to debating this issue again, also actually in an upcoming session with the Finnish perspective as well. And I thank you all for joining, both as participants and speakers today. And as mentioned, I'll be sharing the recording later on. And indeed, let's work together across borders to improve health. Thank you.
Thank you very much.
Bye-bye.
Thank you.